Welcome to TCU Pulse Check, the DNP Edition, a podcast from the TCU Harris College of Nursing and Health Sciences. This show highlights the stories, leadership journeys, and real world impact of DNP prepared nurses who are shaping the future of healthcare. Whether you are a student, a practicing clinician, or a nurse leader, this podcast offers insight into how advanced practice nurses drive innovation, influence systems, and improve outcomes. I am your host, Dr. Paul Biluan, and with me is my co host, Dr. Kimberly Posey. And today we are excited to welcome Dr. Megan Carter, a nationally recognized nurse executive consultant, author, and founder of MC Healthcare Consulting. Dr. Carter brings a fresh, practical, and highly relevant perspective on leadership, burnout, operational chaos, and how nurse leaders can thrive rather than just survive. And let me just introduce Dr. Carter further. Dr. Megan Carter is an innovative nurse executive with nearly 20 years of experience leading healthcare teams across the country. She earned her DNP in executive leadership from Duke University and is board certified as an advanced nurse executive. She is also a graduate of the AONL Nurse Executive Fellowship. Dr. Carter is the president and founder of MC Healthcare Consulting, known for creating the Chaos Whisperer movement, helping healthcare leaders reduce burnout, meeting overload, and operational chaos through her simplified to impact framework, coaching, workshops, and keynotes. She hosts the podcast The Chaos Whisperer of Healthcare and serves on multiple leadership committees, including the North Texas Organization for Nursing Leadership, the AONL Annual Conference Committee, and the advisory board for the TCU DNP program. We are thrilled to have her here on Pulse Check today, Dr. Carter.
Thanks for having me, you guys. I'm so excited.
Well, thank you so much for coming here and sharing all of your wisdom about chaos and how to these nurse execs can kind of work their way through all of it here. So you completed your DNP at Duke. So how did that education really shape this philosophy that you have about leadership and the way that you approach these complex organizational challenges with nurse leaders?
Yeah. Well, I think you used a key word there, Kim, which was complex. So I remember as a manager and a director, I was struggling to figure out how to bring evidence-based practice into our organization more quickly. Because at that time, I believe the gap was around 18 years from the time a new finding was established and published and us actually making that change in nursing. And so I realized early on, while my master's degree absolutely prepared me for leadership, it didn't necessarily give me all of that important skill set to translate that literature in a way that made sense to my clinical teams. And so that's what drove me to get my DNP. And specifically at Duke, I started my program in 2019. And so at early 2020, when we're ready to implement our projects, the pandemic hit and our cohort came to a screeching halt for a moment, understandably so. And I will tell you the compassion and patience and support that they provided us taught me a lot about tenacity and resilience and observing the other CNOs in my cohort and ACNOs in my cohort, how they were navigating it. We were able to share best practices even through group text. It's like the walls had been removed between us and we were happily sharing policies because none of us knew what was happening in the beginning. And so while it was a highly stressful time, I don't want to live through that again. It was an excellent affirmation of the value of having a DNP and going through that program. It made me a better leader so I could help my clinical teams pivot faster and keep their patients safer in such a dire situation.
Dr. Carter, it's very interesting that you were completing your DNP as the pandemic hit. I was also doing the same, and I remember presenting my project virtually because we could not go to school.
Right.
But tell me about your professional journey and what actually led you to doing DNP versus other doctoral programs like EDD or PhD.
Yeah, it's a great question. So I understood it best. In my mind, I probably oversimplify it, but PhD is beautiful in the sense that it's generating new knowledge. We have a question, there are no answers. Let's figure it out ourselves, which is beautiful. And DNP was more practical. Let's take the knowledge that exists and actually implement it in a really evidence-based way. And so because I was in an operational leadership role and was moving up to that executive level, I chose the DNP and executive leadership so I could pull those levers for my teams faster. It also made me more articulate, helped me create better business cases with the non-clinical executives to help become a better advocate for all of nursing and their patients. So that's where I went with it. Education's a passion of mine as well. And who knows, I might go back for that someday down the road. But that's why I chose the DNP route.
Yeah, it seems like we're never through going to school. There's always something. Yeah,
Yeah.
even though it may not be a degree, it could be a certificate, or there's always just something that we want to keep moving forward.
Yeah.
But we would love to hear about that chaos whisperer movement. Like, where did that come from? How did you create that? And what kind of problems were you hoping to solve with this?
Yeah, I love this question. So it's funny because the term chaos whisperer was actually an accident. So early on when I started my company and I was refining what it is I'm offering people, what pain points am I trying to heal, to try to help? What does that look and sound like? I don't know where the term came from, but I updated my LinkedIn profile and my headline said chaos whisperer. And as I was gaining followers and people were interacting with me from all over the country, they were really drawn. The consistent comment, I'd get dozens of messages a day. I love that headline. Like that's what we do as healthcare leaders, not just nursing, all healthcare leaders. And I thought, this is the world telling me from a marketing standpoint, this is what we're doing. And so being in the executive fellowship with AONL, I'm in conversation with these other CNOs, and I realized we do a really great job of teaching theory and frameworks and leadership at a high level. But we don't necessarily give new nurse leaders or even experienced leaders practical strategies on how to manage a triple booked calendar or how to deal with really ineffective meetings or how to hold boundaries, create even workloads. We just don't have those conversations often enough. And for me, having been a manager and a director and an ACNO at different hospitals around the country, I could see from personal experience, this is a universal struggle. No one really has this truly figured out. And I thought, that's where I could come in and really help these healthcare leaders, nurse leaders included, is give them those practical strategies. They don't need necessarily another conference on theory and inspiration. We've got a lot of that. But the literal how do I get more sanity back in my workday? And so I frame it as Maslow's hierarchy. I use that visual a lot because we all understand it. Most nurse leaders are functioning at the bottom two layers. They're in firefighter mode. They're literally focused on minimal safety, staffing, payroll, HR processes. At the top of that pyramid, though, are things like innovation and transformational leadership. That's what we want to be able to do. But the how to get from those bottom two layers, get them unstuck from those bottom two layers so they can do those higher level leadership activities, that's what the movement and the workshops and the keynotes are all about.
Thank you for that, Megan. And I know I follow you on LinkedIn. You've talked a lot about this, healthcare leaders experiencing burnout, meeting overload, and operational chaos. What patterns do you see most often, and why are they so persistent in what we do in healthcare?
Yeah, I think this is my theory, and I could get in trouble for saying this. This is my hot take. The US healthcare system we know is the most expensive in the world by a mile, and yet we have some of the worst outcomes. And when you look at complex adaptive systems, it is designed to continue functioning as it always has. It will require disruption for us to make it better, something new and innovative we haven't done before. And when you look at culture and leadership in healthcare, especially in nursing, we value things like altruism, self-sacrifice, service for the sake of others. However, we do it at the expense of ourselves. And that's what's been normalized in our culture here in the US. It's not necessarily that way in these other developed countries where they have healthcare systems. And so I realized that, okay, I can give the practical strategies, but also we have to talk about our mindset and this culture that we are all responsible for. We've all, whether inadvertently or purposely, we've all contributed to this. An example of that would be making a comment like, oh, Megan put in 60 hours last week. She's a real hero. Man, she went above and beyond. Or receiving an email at 2 a.m. from my chief nurse asking me a question. The fact that she's sending emails overnight tells me she might expect that of me. But we don't have these conversations out loud. And so I think the burnout and the overwhelm and the stress happen because we have a tendency to keep adding people and resources and projects. We never stop and take things off our plate. We never really pause and say, okay, what's no longer value added? What audits can we stop doing? What tasks can come off our plate to make room for these new requests? And oh, by the way, let's normalize having healthy boundaries around our time outside of work and figuring out what work aligns with our priorities, what doesn't, and how to say no to that professionally. So I think I say that's a long-winded answer. It's very complex. I think there's individual and system level factors that play into it. But first, we just have to admit that we do have a problem and what we've been doing is not sustainable.
Yes, I agree. And have the chaos whisperer bring in the chaos theory. I love that, with the complex adaptive, system that is just so relevant. I mean, as old as that theory is, it still
Yeah.
has such relevance today in what we do. And Paul and I can say this, we heard this from some other people we've interviewed that, it's doing the same old thing, the same old way, or always saying this is the way we always do it. And we need that disruption,
Yeah.
right? We need those disruptive innovators to come in. And, I love how you kind of pull that all together to try to, curb that burnout, because you're right, we're not necessarily making progress in our healthcare in a healthy way.
Right.
So that simplify to impact framework you use a lot, and it's gained traction. What are those core principles for nurse
Yeah.
leaders to use that?
Yeah, so that particular workshop is typically a full day workshop, and we cover several topics. So we'll start with something as simple as why healthcare leadership overload happens in the first place. And that overload happens, as we just discussed, because of big, large system factors all the way down to individual factors. We need to understand how we got here in order for us to figure out how to shift the navigation. Then we get into some strategies like calendar triage. And so you'll appreciate this. So I have a triage framework I use that looks just like an ACLS algorithm, except it's for any healthcare leader to take their calendar and run their meetings through this series of questions to determine what of these meetings are value added for me to personally attend or continue having, which ones can come off our plates. And then, by the way, how do I decline meeting invites in a way that maintains those positive working relationships? The goal of that is to create these pockets of what I call protected time. And they use that protected time to actually go out and engage with the nurses, with their clinicians. Because we know from the literature that that intentional face time and those meaningful conversations with the leaders, that's what solves problems, that's what retains the nurses, and that's what gives safer patient care. Then we go through other tactics like meeting streamlining, because we can't get rid of all meetings, but let's take the few that are truly mission critical and let's figure out how to make them more efficient and action oriented. Then we'll spend some time talking about workload, what their actual priorities are as a leadership team, because we can't hit all the things every single day, every single week. So how do we decide what's important based on an effort impact matrix? Then we spend some time talking about professional boundaries, using scripting and role play on how to have those conversations and hold those boundaries in a way that everyone feels safe and comfortable. And then I always end the workshops with nervous system reset tactics. So things like breath work, mindfulness practices like tapping. And we get everyone to agree to try something new for 5 minutes a day that upcoming week to simply help them and their nervous system get out of that sympathetic fight or flight back into that relax so that they can show up as their best, healthiest self at work with their teams.
Megan, I like that you're actually focusing on the practical aspects of leadership, because we've all been through leadership workshops and seminars and trainings and
Yeah.
webinars and all these things. But it's rare for me to actually hear somebody providing practical, practical applications of all these things. And I think that's very important. In one of our episodes, we talked about how our healthcare is getting even more complex compared to 10, 20 years ago. And along with that, nursing is evolving. But not only that, nurse leaders should also evolve along with
Right.
nurses. So it's just getting more complicated. It was designed that way. And like we all said, we need
Yeah.
innovative disruption to handle this. But
Yeah.
for DNP nurses that are stepping into executive roles, what do you think are the skills or mindsets that are essential for leading in today's very complex healthcare?
Yeah, I would say number one is know thyself. And by that, I don't mean just take another personality assessment, although those are important, but using some sort of assessment tool. I've used several of them personally. They all have their pros and cons, but have a really deep understanding of what your stress triggers are, how you navigate stress, how you show up at work, what work lights you up from the inside. The reason I think that's an important foundational step is a lot of us assume we know ourselves pretty well, but you really need those assessment tools and ideally peer feedback and even mentor feedback to help you create a clear picture of the kind of executive leader you want to be compared to how you're naturally wired as a person so that you don't get frustrated. I think the other important skill set to have is grace and patience. You're going to be taking on as that executive leader everybody's issues. You're going to hear about all the things that are wrong, and it's normal and natural to feel overwhelmed and powerless. Absolutely normal. It's that serenity prayer of recognize the things you can control, the things you cannot, and the wisdom to know the difference. You're not going to solve it all. You've got a whole entire beautiful team of brilliant people. Leverage that. Have the humility. And then the third thing I would add is never stop learning, whether that's through certification, going back to school, going to these conferences for those CEs. To your point, Paul, things are changing. AI is changing our space, I swear, every other day. And that pace of change, in order to become an effective and maintain that effectiveness as a leader, you really need to stay on top of that. So creating some protected time here and there for that. And then the most important thing, of course, is self-care. Because if you are not role modeling self-care and you're showing up to work exhausted, bedraggled, that sends a message to the rest of your team that you appreciate that more than you do someone who's healthy. And so remember that every word, every action, every behavior is a reflection and sets the tone for everyone else. Big responsibility. So do yourself a favor and model that self-care, whatever that means for you.
Those are great words of wisdom. And, I think it's really important, especially for our, the current students, current DNP students, as they listen to this practical advice of things that, they're not going to get in the classroom or, like you said, in another seminar, but these very practical tips. But if we have some DNP students that are thinking, wow, maybe I want to be an entrepreneur, maybe I want to step into an executive role or in a consulting role, are there some words of wisdom or advice for those thinking about diving into those areas?
Yeah. First of all, do it. We need you. Innovation is best completed by those who have done the work themselves. There are these big, massive consulting companies we're all familiar with that have made billions off of trying to solve our problems in US healthcare. And considering where we're at today hasn't been very effective. Most of the time they're well intended. They've never actually worked in healthcare. So trust that you are an expert in your field and you are desperately needed. From a practical standpoint, I would say spend some time thinking about what it is you're going to offer, whether that's a service or a widget. And then I would really highly encourage anyone who wants to expand their lens from a professional perspective or become change agile is really start networking. We don't talk about networking a whole lot. And by networking, I mean in person, whether that's through a professional organization locally or nationally. LinkedIn is a very powerful platform. It has changed my life personally. I'm coming up on year 3 of my company and being an entrepreneur, and I've already got so many events lined up for 2026 because of LinkedIn. I don't know how I would have made it without it. And so there are a lot of practical strategies they can use to kind of grow their network and get people to view them as a subject matter expert on whatever that niche is that they're passionate about. So I would start with that, be clear about what you're offering, and then also just be prepared. It takes most of these folks that, like the Renee Thompsons of the world and Brene Browns of the world, it takes them years to get to that point. And we're only getting to see the Instagram, polished versions of what their journey has been. So make sure that if you're going to step out on your own, that you've surrounded yourself with people who have done it and can support you. And then also financially prepare for 2 to 3 years of income because it's going to take a while to build your brand and for people to want to buy from you. That's just natural.
Wow, very powerful advice for our DNP students, and that's really
Mm.
important. I remember that back in DNP school, they asked us to open a LinkedIn account. I never used it,
Yeah.
and after finishing DNP, I started using it, and that's how
Yeah.
I started to get to know you guys and a lot more leaders, which is very important. I think all DNP students should start
Yeah.
networking now while still in school.
Yeah, absolutely.
And Dr. Carter, you've mentioned about AI earlier, but what other things that excites you most about nursing and nursing leadership in general?
I am really excited. This might be an unpopular opinion, but I'm really excited about Gen Z. I know some of the other generations get frustrated because they don't understand the way they value work and life balance. But I'm excited because here's the thing, they're not going to tolerate this martyrdom and this self-sacrifice to the point of burning out. They're not going to do it. And so, because of that pressure, it's going to force us, the other generations, to pivot and figure out how to meet them where they're at. But in doing so, we're going to create healthier work-life balance for ourselves. So they seem very passionate and they seem like they are going to change the way we spend our time at work and at home. I think it's going to make us all a whole lot healthier. Not that it's easy, but I do think they're going to force some of that. So I'm very excited about that.
Oh, yeah, excellent. Wow, this has just been, fabulous, very practical, hands-on tips. I learned some good things about my own calendar just listening to you, some things I can, take in meetings. Yeah,
Yeah.
that I can definitely take and use starting today. So
Yeah.
I appreciate those practical tips, and those are really powerful insights and really what our listeners need and our students. And we again thank you for joining us. So, are there any last words that you have for us? Anything else?
Just if anyone's interested, I do have lots of free tools like that calendar triage tool on my website. You guys are welcome to go grab that anytime. Share it with people who you think might need it. And you guys can connect with me, like Paul said, on LinkedIn or by email. Super responsive. Would love to connect with you guys. And if anybody needs help connecting to professional organizations or networking, always happy to help support. But I just want to say to those who are in their program, you're amazing for going back to school. You've got this. And there's a whole community of other DNP graduates who get it and who are here to support you. We get it. So thank you for everything that you do every single day. We need you.
Wow, thank you so much for offering to be a resource. And she means it. She's very accessible and very helpful. And so, to our audience, again, thank you for tuning in to the TCU Pulse Check, the DNP edition. Have a great day.
Thanks, you guys.